Today my goal is to make you fibromyalgia aware. 1 out of about every 30 Americans suffers from fibromyalgia. The census estimates the population of the United States to be 315 million. If 1 out of every 30 people have fibromyalgia, that would mean that there are more than 10.5 million sufferers. That's 3% of the United States population. Fibromyalgia is the most common musculoskeletal condition, second only to osteoarthritis. Still, it is often misdiagnosed and misunderstood. I graduated from nursing school in July of 1999. I have worked as a surgical scrub technician, a family practice nurse, and a home health nurse. I began having problems in 2008. I continued on thinking that it was just my age. Over time and several visits to my doctors and numerous tests being run, I was officially diagnosed in 2010 with fibromyalgia. I voluntarily retired from nursing in July of 2011. I could no longer function at the level needed to provide the care that my patients needed and deserved. Most of the medicines that are available to help have given me severe side effects. I'm allergic to over 39 different medications. I will touch on several topics that should provide you with a starting point of being fibro aware, including what is fibromyalgia, how do they diagnose and test for fibromyalgia, and what are the treatments for fibromyalgia. We can begin with getting you to understand exactly what fibromyalgia is and its effects in sufferers and others. By definition, fibromyalgia from WebMD is a syndrome consisting of several symptoms that define it. There is widespread muscle and joint pain, fatigue, anxiety, or depression. Sufferers also tend to have several of these symptoms also. I unfortunately have all of them. Restless leg syndrome, abdominal pain, chronic fatigue, chronic headaches, insomnia, hypersensitivity to cold and or heat, which is why I'm wearing gloves, inability to concentrate, also known as fibro fog, irritable bowel syndrome, numbness and tingling of the hands and feet, and stiffness. The inability to concentrate or fibro fog is one of the more prominent symptoms with sufferers. Fibro fog alters your memory functions, your thought process, and the ability to make decisions. Restless leg syndrome is a disorder related to sensation and movement. Makes it hard to lie down and affects sleep because you have the urge to move. Usually it affects your legs, but it can cause unpleasant feeling in your arms and your torso. That is why I'm allergic to all the medications for restless leg syndrome. That is why I am wearing a TENS unit on my legs. That is the only relief I get from my restless leg syndrome is with my TENS unit. Now that we have laid down the foundation with what is and what effects it can have on your body, we can now proceed to how it gets diagnosed. Doctors rely on a comprehensive physical exams and a medical history. They look for widespread pain over the entire body for at least 3 months. The chart shows 18 points on the body. They look for pain or tenderness in at least 11 of these 18. The back of the head, the top and the mid shoulders, above the scapula, your buttocks, your hip, your lower spine from C5 to C7, your second rib, the antecubital, and your knees. They will likely do lab tests to help rule out more serious conditions. They will look at Lyme titers, anti-nuclear antibodies, rheumatoid factors, ESRs, prolactin level, calcium levels, glucose, hyperthyroidism, and vitamin D. Okay, we know what it is and how they diagnose it. Now it's time for treatments. There is no cure for fibromyalgia. There is also no treatment to address all of the symptoms. Therefore, a combination of treatments is used to address different symptoms. There are several traditional and alternative treatments for symptoms. Several different drugs have proven to be beneficial treating symptoms of fibromyalgia. This includes drugs like Lyrica, Cymbalta, Savella, Flexeril, Effexor, and Ultram. They have also used Prozac, Paxil, Zoloft, and more recently Neurontin. Unfortunately, I'm allergic to all these medications. There may be certain types of foods that help alleviate symptoms caused by fibromyalgia. Fruits and vegetables and certain juices may help and limit to caffeine. They may also suggest low-impact, moderate workouts to help maintain muscle tone and body health. This could also help provide a more restful and sleep by tiring out the body. My doctors have few options in treating my fibromyalgia because I have allergic reactions and severe side effects to most of the medications that they have proven to help with the symptoms. I have altered my dietary intake. I have also joined a gym to help keep me fit and try to tire me out to get some sleep. Sometimes it's difficult just to get out of bed. I hope that I have provided you with enough information to make you aware of fibromyalgia and how it can affect everyone around it. No one truly understands fibromyalgia, but we are learning every day. Like any other ailment, we are in search of a cure. Worldwide, fibromyalgia affects 3% of the population. Fibromyalgia is a painful group of symptoms that affects approximately 11 million people in the United States. Doctors have to go through the process of evaluating symptoms and monitoring your pressure points and diagnosing fibromyalgia. Treatment is for symptoms, since there is no cure for fibromyalgia. Through medicines, diet, and exercise, you can live a little more normal lifestyle. I know several people that suffer from fibromyalgia, myself included. It will change your life and the lives of those around you. Not a day goes by that I wish the pain would go away and I could live a normal life. Fibromyalgia is definitely real. Please become aware and educate others. And please excuse me for sitting through this speech, but due to the weather change, I'm having a fibro flare-up. And with this, it's caused me to have a 7 out of 10 pain and has increased my fibro fault.